into your limbs.
Yeah.
Your blood pressure dropped, your heart rate slowed down, and your headache's gone.
Yeah.
This really was fascinating. Today on the Dr. Oz Show, it was all about learning how to live life holistically. The basic premise of holistic medicine is that it treats the whole self, body, mind, and spirit. In practice, it relies a lot on a healthy diet, natural remedies, and vitamins to improve health, prevent disease, and boost energy. Conventional medicine looks at the physical body and is more focused on identifying and treating a problem.
Dr. Andrew Lipton practices a holistic approach, joining us now. It's nice to have you with us.
Nice to be here.
Okay, let's talk first. We explained a little bit about what holistic means. It's the integration of mind, body, and spirit. It's not looking at a symptom and diagnosing and treating a specific symptom. For example, I asked Thomas about headaches. It's not necessarily taking an aspirin for a chronic headache. It's about looking at what may be causing those headaches.
Exactly, looking at the whole body. Our modern medicine and traditional medicine says, all right, it's pain in this area that we're going to focus on the disease process, and there may be emotional and there may be spiritual aspects to every disease. And the traditional approach is, with medicine, here take an aspirin, but there may be other issues why people have
So it's mind,
headaches.
body, and spirit, and this relies, as I mentioned, a lot on the diet, a lot of what you're putting into your body.
Absolutely. We are what we eat, and so holistic medicine is one of these terms that maybe encompasses complementary, integrative, and alternative medicine, and they're not mutually exclusive. Some people are holistic that are surgeons, but in general, surgeons are very specific into the one organ they're operating, and there's some holistic doctors that basically, look at the whole picture. It really is very broad.
Okay, let me ask you a question before we get into some more of the specifics. I know a lot of people think very practically when they think about medicine. They're wondering if their insurance will cover doctors who take a holistic approach to treatment. How does that work?
In general, if we look at holistic or alternatives, like I said, a physician, MD, DO could take an holistic approach, but alternative medicine, complementary medicine, herbal remedies, these are all alternatives that are generally not covered by our common health carriers.
So how would a person know whether I go down the conventional road of medicine or take a holistic approach?
Well, I think it's always great to look at both, and that's where I use my complementary and alternative medicine. I use both my traditional family medicine, and I offer natural options for any health issue. So we can look at both, and that's, I think, the best of both worlds. And that comes into who do you pick for this type of practitioner? Well, you want to look at somebody that's trained, accredited universities. You want to see that they've had a residency or they've had board certifications, and you really want to look at how long they've been in practice.
So you really got to do your homework. So let's say you're a 30, 40-year-old woman. What would be the holistic approach to living a better life?
Well, that's a very broad question.
But
so,
just a couple of tips.
Number one, hydration. Most people walk around dehydrated. Number two, good nutrition. And that generally for me is eat more fruits and vegetables. The anti-inflammatory properties in foods are marvelous, and eat less of the saturated processed foods that are in boxes, cans, and wrappers.
Remember, what you put in your body makes all the difference. Dr. Andrew Lipton, always good to see you.
Thank you so much for being here.